So welcome. One of the key things that you have to be able to do as a colonoscopist, he says holding a gastroscope, is be able to identify cancer within colorectal polyps. And it's really important you freeze the image. Like, photography is everything. Like, this is a beautiful photograph right here. Why is it a beautiful photograph? It's clear, there's nothing on the lens, there's no debris on the polyp, thanks Peter Yan, there's no off to the center, it's right in the middle, and it's quite distended, right? So from this photograph, we can already make some assessment of this colorectal polyp. And we can do that using 6 blink features. Now, what are the 6 blink features? Well, they are fold deformation, extra redness, ulceration, spontaneous bleeding, depression, and chicken skin mucosa. I just read those, but you should have them on your computer screen, like I have them nicely attached to the computer screen in here. And why should you? Because they allow you to shortcut your thinking about colorectal polyps so that you can immediately identify visual cues of cancer. So, what do we see in this image? Well, in this image we see, and I'll show you the individual features separately in a second, but I'll just list them: extra redness, spontaneous bleeding, chicken skin mucosa, and perhaps depression. Let's get into it. Okay, so we've done all that from just freezing the image, right, when you first see it. And that's why we call it first impression, because it should actually be, okay, I've seen this thing, all right, my first impression is that it's got how many of the 6? And we showed nicely in a cohort of over 150 general endoscopists that this works, and that more than 2 of those features indicates the presence of cancer, and invasive cancer within the polyp. So what are we talking about? Well, the position is not so easy. I took the cap off. I would normally have a cap on so I can show you better. So let's start with chicken skin mucosa. Underneath the polyp at the 6 o'clock of the image, this is patches, speckles, white speckles within 10 millimeters, I would say, of the polyp surrounding it. And you can very clearly see them here. The next feature that we can talk about is spontaneous bleeding. Now, Peter Yan assures me that he didn't do anything to this polyp, and so what you see on the surface of this polyp is bleeding that has been occurring spontaneously. So usually it involves not having put a water jet on it, not having biopsied it, not having done anything to it before you have that appearance to count that blink feature. Then extra redness. So it does also apply in virtual chrome endoscopy, but if we just come back on this polyp and I try and stabilize it, you can kind of appreciate that the center of the polyp is maybe more red in a kind of arc than the rest of the polyp. So maybe this is extra redness within the polyp. And then you do have convergence of a fold into this polyp. Like you see the fold now from left to right is kind of converging within the thing. Is this fold deformation? Is this a depression? I'm not sure this has a true depression in it, this polyp. So potentially we are talking about fold deformation. But anyway, we have got more than 2. Definitely, of the 6 blink features. And what should this tell you? This should tell you that you should escalate this polyp. If you are an interventional endoscopist in a quaternary center performing endoscopic resection, as we are, in this case, after consenting the patient for endoscopic resection, then you can proceed to do a technique taking into account the fact that this is probably at least at risk of invasion, deep invasion. If you are a general endoscopist finding this lesion on a screening list, then you should document the presence of these features, and more than 2 blink features should escalate this to multidisciplinary team discussion. If you have in your department an endoscopist who's experienced at this kind of thing, you should discuss it with them, maybe get them into the room live. That's going to be the best way. Otherwise, you make a nice standardized video, 20 seconds of white light, get in there, get some magnification on, go slowly over the surface so they can see the pattern, and then please use that button on the endoscope that switches the light to virtual chrome endoscopy. And it's suboptimal because we don't have a cap, but go over the surface, because actually the last part of blink assessment is look closer. And the look closer can be done by you, but also must be done by the person performing the endoscopic resection in the end, potentially. And that person needs to make an assessment of the vascular pattern and what type of endoscopic resection to offer the patient. So there you go, and now I've traumatized the surface, Peter Yan, so it wasn't just you. There you go. So that's 6 blink features, that's how you use it. Thanks very much for watching, and if you want to know more about it and hear world-class experts talk about using it in general endoscopy, then you can come and see us at GIEQs VI at the end of September 2025.